Joel Tyner, your man on the street reporter here, my lovely wife Layla, and the one and only Chatham Police Chief, all the way from Columbia County, Pete Volkman, national media attention, of course Francis Sandiford, Sally Kane, and of course we have Panda here. What is going on up there? What are the miracles that you're making happen up there in Police Chief Volkman?
Well, we started a program. We have a huge public health crisis of the opioid situation and people dying. And it was about 2 years ago, maybe a little more than 2 years ago, many kids in Ichabod Crane School District were recent graduates. 4 of them died during the summer. And one of the kids that I knew, he was a great kid, and he died of a heroin overdose, and that just hit really home for me, that this can happen to anybody, and get caught up in that. And so I researched and found a PARI model out of a police department out of Gloucester, Massachusetts, that made the decision to help people find treatment. If they voluntarily come in and say, I need help, that they'll find treatment. So went to PARI, researched it all, and it came back realizing we're a part-time police agency, we don't have a lot of money, we don't have a lot of resources, I don't know if we could do this. Was going to many community forums and many meetings, and was talking to my lieutenant. This doesn't make sense. There's no way we can sustain this. There's no way that this can happen. And we were at a community forum, and just before I was going to speak to the community, my lieutenant looked up at me and said, with all due respect, sir, jump. Just do it. Just announce it. Just jump. Don't worry. We'll figure it out. I got your back. And I made the announcement at that meeting that in 30 days, we were going to start the PARI program. We didn't know what to do. We modeled it on the Massachusetts model, and put policies together, got a lot of help from the PARI program, and we figured, okay, we're ready to go. And it took about 3 weeks for the first person to walk in. And the first person walked in, and we realized very quickly that the Massachusetts model does not work in New York State at all. So we had to go on a fly. About 5 to 10 minutes later, another person walked in, and they needed help. So now we had 2 people with no knowledge of what to do. It took us about 12 hours to find that first person a treatment bed, and off to the races we went. We had to learn very quickly the New York State system and how it works. So we started working on that. It wasn't until about September, I think, that I realized that we had something good here, and we needed to research it to see what we're doing right, what we're doing wrong. And so the University of Albany School of Public Health, I had a meeting with them, and they said they would research us with data and assist us with that. So they jumped on board. We also realized after the first day we needed help, so we created what we call community angels, which were volunteers from our community that would just come and sit with the person, because way in the beginning it would take us hours to find beds. But as time went on, we didn't need the angels, because now we could probably find a treatment bed with insurance approval within an hour with confidence. Albany has found out it's about 75 to 80% of the time. We'll find a treatment bed same day. You come in, we're going to get you a treatment bed, which is unheard of in the mental health community to be able to get that with insurance approval. But we've learned how to navigate the dysfunctional insurance system, and we learned how to navigate the dysfunctional treatment system, and the recovery system itself is very dysfractured that way. So learning that navigation system through experience has got us to where we are, because most families, when they reach out, they don't have the experience we've had, and so they do their best, and it's very disheartening for many families. So many families have spent a month trying to find a bed, and within an hour we find a treatment bed with insurance approval. So we just kept going forward. Over 180 people, I think 185 we're at, have come in, and we found beds for 100% of the people. Never turn somebody away, say there's no hope for you.
How do you do that? There's a special, I understand there's a little bit of resentment, understandable and justified by other members of the community. They're like, how do you guys do this?
We found that not everyone appreciates what we do, because a prominent person, clinical director of a health agency, came up to me after one of the forums and said, Chief, you know, I'm just gonna be truthful, is that we hate you. How can a bunch of cops do what we can't do in the mental health field? We all have PhDs and we can't navigate the system like you. And I always say, come watch, get our training. We'll train you how to navigate that system. It's not a flow chart. The system is just not a flow chart. It's fluid, and you gotta sit down with the person and see where they're at. And then you gotta figure out what insurance they have, and then where can they go with that insurance. And so that's where it's not a cut and dry thing that we found in helping someone, because everyone's road to recovery is different, and that path, we want to get the correct path to get you off on a good start, whether it be ambulatory detox, whether it be inpatient detox, whether it be rehab, whether it be outpatient services. So we really need to get to know you, we need to get to know the families, and then we can kind of figure out your best road. And your insurance, this is all insurance driven. If the insurance company says no, we have to start all over again. So yeah, there's a lot of resistance that way, and the problem being is that people have listened to you know, Richard Nixon when he coined war on drugs, and all of a sudden there was a war in our community, and the police took this war to heart. And then when Nancy Reagan said, just say no, it seemed so easy for people, well, they should just say no. And I always go and I talk to people and I say, how many of us have tried a diet and it didn't work? Well, just say no to muffins. Just say no to chocolate. Just say no to soda. You know, it's not that easy to just say no. So to turn and say, well, they're doing it to themselves, they should just say no, is actually a fallacy. But we bought into that because it seemed like an easy fix. We'll just teach our children to just say no, and it's that easy. And then what happened was the timeline here was that pain became the fifth vital sign. And all of a sudden, pain, everyone expected a zero pain. And so that's when the market started getting flooded with pain pills. Because I remember when I was a kid, and I always tell this story, when I got my first filling, the dentist, when he was done, turned to me and said, when the Novocaine wears off, your tooth is going to hurt for a couple days. That was it. I was just told it's going to be sore. Your mouth's going to be sore. So now we have a zero expectation of pain. And I don't always blame the doctors for it, because there's civil laws that doctors can be sued by the patients if they perceive excessive pain and suffering. So the doctors are watching out for themselves due to the laws that were passed in New York State. And so we've just gravitated to this, and then we cut off doctors from prescribing, and then people couldn't get their pain pills where they were functioning on pain pills every day. And they naturally gravitated to heroin. So we're exactly where we should be. And then with the heroin, the synthetic heroin is really what changed everything. That was the game changer. We've had heroin for hundreds of years in society, and people have functioned on it. But now that we put heroin and fentanyl, heroin and benzodiazepine, that was the game changer for us. And that's where people started dying. So I think it's a multitude of things that brought us here. And I realized as a police chief, I just can't sit around and think I, as a police, can arrest our way out of this. Ask any police officer in the United States, can we fix this by arresting our way out of this? And no, because if you look, you can have the biggest drug bust in your community ever. And I guarantee you in 24 hours, that pipeline's opened up again. We can't. So if we can't stop the supply, I'm not saying try to stop it, not go after major drug dealers and not go after cartels, but maybe let's try to lower the demand. So if we lower the demand, there won't be need for that supply. It's just an economics 101 decision that I thought, let's try something different. For 40 years, we've been on war with drugs. For 40 years, we've been trying to wrest our way out of this, and for 40 years, it hasn't worked. Why would this year be any different than the past 40 years? So I'm not saying that this is the answer, but this is part of the solution, is to help people. And if you help people, then if they stop using it, and you think about that, it's an amazing that how the numbers go up. We had 185, and I'll just say 100 people were heroin addicts, and there were a lot more, but let's just use round numbers. And the average is a $100 a day habit, a bundle a day when people came in. All right, and so let's take one person, and all I'll say is they've been in treatment for 30 days and they stay clean for 30 days. So one person at 100-day habit for 60 days doesn't use. That's $6,000 of heroin that wasn't used by one person. Now, multiply that by 100. That's $600,000 of heroin that wasn't being used by this program. Now it's actually more. I think it's more towards $1 million. We have stopped $1 million worth of heroin being used on the streets. It's not flashy, you know, it's not something that's real cool on television news or anything, but we are doing crime prevention because we also found not only has that happened, but we haven't had the fights, we haven't had domestics as much in families that have loved ones that are struggling with it. Just a lot of aspects. We've helped homeless people who now have jobs and have come off of welfare. We've had drug dealers come in and say, I'm tired of this lifestyle. I need help. And so there's a lot of byproducts of crime prevention that comes with this program that I didn't even realize until I'm halfway through this. And I'm like, wow, we're doing a lot. So, you know, this has just expanded, and with the UAlbany research and validation of statistics of people coming in, because there's no research at all on who's coming forward. We're the only ones that have that. UAlbany has that type of research. So if we have that research to validate us, if we're showing we're saving money for the communities and we're keeping families together, why would anyone not want to do this? That's the question I have. And it goes back to war on drugs. They're the enemy. Just say no. They should just stop. And we bought into those two things, and that's why we don't want to do it.
That's right. That's true. Can you talk about the human aspect of it, the things that you've seen?
Sure. In order to come in, we've learned this, that you have to be in withdrawal. And it's pretty tough because you can't use for about 20 hours. And somebody who's struggling, that's a long time. And the physical and the anxiety that comes with that. Most people don't want to use heroin. They just don't want to withdraw. And we found that 75% of our people coming through started with pain pills from a doctor. They had a procedure, they started with pain pills, then they were cut off from pain pills. They didn't want to tell anybody in their family they're hooked, so they naturally gravitated towards the heroin just to keep going. Or they gravitate to other types, the benzodiazepines or anything like that. So, and now they're caught up into that. So I wish we didn't have that. I think that, you know, anybody should be able to come in and say, I need help, I have a problem. It's kind of like asking somebody coming in saying, I have chest pains, and saying, well, your heart attack isn't big enough yet. Come back to the emergency room in 10 hours when your heart attack's really bad and we really know you're having a heart attack. Right. I liken that. And, you know, and then other people saying, with the human aspect, get to meet them. You know, don't look at what you've been told of a typical heroin addict. They're regular people. They're wonderful, wonderful souls. And I have our Chatham Cares for You Facebook page, and every soul who's walked in, I've told their story. Because I think people need to hear the positive recovery that's occurring and the struggles that we had sometimes to get them into treatment. This isn't like an easy thing where we just make a phone call. I don't want to come across like this is easy. This is something that it takes a lot of effort sometimes. So that human quality is changed a lot of people's perceptions. And I think today, the whole idea of the recovery movement is growing because it's affecting all of us in our communities. And we're starting, and a lot of people in recovery are starting to come out of the shadows like I am, to say I'm in recovery. There's a lot of successful people in our communities that are in recovery. They just haven't come out of the shadows. So as more people come out of the shadows and we realize they're just like regular people like me,
right.
I'm no different than anybody else, but I'm one of the 30%ers biologically that can become addicted.
Right.
It's just 30% of the population. They're still learning a lot about it. So I'm a susceptible person to that. So I'm a 30%er of the population that can get addicted. Doesn't mean you always do,
Right.
but I'm just well aware of that. So yeah, I think the human aspect is starting to hit
Right.
and change viewpoints and prejudices towards those
Right.
who are struggling.
I don't think there's any such thing as a throwaway human being. And,
Not at all.
and so many times in our society, I think we they're the other, they're the enemy, that, like you said.
Yeah, and I see that right now today. The media is playing on two survival emotions of fear and anger. And I see that a lot with that. Yeah, and why? Because fear and anger sells. It sells papers. It gets you to watch. Create fear and anger, create conflict. Us and them, they're no good. But fear them because they're going to steal from you. They're, never trust them again. All fear and anger. And that fear and anger is just festering our society right now, to the point where we're struggling even to have conversations like this. This is really important to have these conversations, to say, yeah, they're human beings. They're regular people. So many people that I've met are just like me that have come through the door. So I see that as me coming through. I'm just a couple chapters ahead in recovery than someone beginning in recovery. But every person I met is, and I purposefully, in Chatham Cares for You, I call them a soul. Every time a soul walks through. And that's the way I see that. And it's hard because people just can't get past what they were told. They're more on drugs and just saying that. It's hard for people to get past that. They're the bad guy. And it's going to take time, but as more people come out of recovery, out of the shadows in recovery, more people's family members realize their loved ones are in recovery, that they're not the bad person. I've never met a person that said at 5 years old, when I grow up, I want to be a heroin addict. Right. I've never met a kindergarten kid say that. And I never did. When I grow up, I want to be an alcoholic.
Right.
I never expected that, but things happened in my life, and then I used alcohol. And to escape, and it quickly got out of hand. And we as human beings, we're looking for that escape, and we find ways, and drugs and alcohol are a way to escape whatever is pressures and stresses, and pain, and all kinds of stuff like that. So yeah, so that human aspect absolutely is important. We need to see that more.
Right.
We need to see that more.
Okay, well, I just, thank you for being here.
You're welcome.
Just, if you could hold that on me for a second. So just thanks to Panda for being here. There's actually a woman in Poughkeepsie named Cursillo who 2 or 3 years ago, we got Jurgen Weckerle, the Sierra Club, all the way from Crawford, Orange County here. Thank you, Jurgen. Even without my glasses, I can tell you. Environmental, he's on all the issues like me. So I found out a few years ago about PARI, and it's the Police Assisted Addiction and Recovery Initiative. The website is paariusa.org. And the first time I circulated a letter on this in early 2016, I couldn't get a bite, hardly any interest from my colleagues in the county legislature. And I kept on pounding away at it. In the summer of 2016, I think I got just about, a majority of the Democrats, at least in the county legislature, on board. And I circulated another letter recently. So credit where credit is due. I mean, it shouldn't be a Republican versus Democrat issue, but I do want to let people know, so far at least, Hannah Black, Chris Munn, Francina Amparo, Giancarlo Olivares, Craig Brenly, Randy Johnson, Nick Page, who are currently in the Dutchess County Legislature, and also Mickey Strzynski and Carrie Reeser, who used to be in the county legislature. So there's like 9 or 10 of us who have signed on to letters to make this happen. But, and I would love to see everybody watching this, and everybody in this room come to the next meeting of the county legislature to speak up, Monday, May 14th at 7 o'clock. But even better than that, I've been having conversations, a little bit, tiny conversations with the person who kind of basically runs the police department in Rhinebeck, Pete Dunn, Sergeant Pete Dunn. And he actually was going to try to be here himself. And he didn't tell me he 100% endorses or rejects this idea. But I'm just asking, Francis and Sally and Jurgen and just anybody watching this, please, if you could just talk to, this is going to people in Red Hook and Rhinebeck, could you talk to the Tivoli Village people, talk to the Village of Rhinebeck people, talk to the Rhinebeck Town Board people, talk to the Red Hook Town Board. It's not just about a county thing. This is a municipal thing. Could you tell the story of how it started with Leonard Campanello in Massachusetts?
Sure. Chief Campanella at the time was kind of in a position where I was, saying, I got to do something different. We can't arrest our way out of this as a solution. And then he just put out, well, if someone's looking for treatment, just come to our police station because
In Gloucester, right?
in Gloucester, right, and because anyone should be able to go to police and say, I need help with anything. And so if you need help with that, voluntarily come in and we'll find you a bed. And he found in Gloucester, after the first year, they did follow up. Half the people who went through Gloucester stayed clean and sober the first year. The national average is like 5%. And so we're at 50. So we went from 5% to 50%. And then petty crime in that city dropped 30% the first year. But it makes sense. If you're helping
And you found the same thing? What is the new safety designation for your village?
Right, and so with our village, we were given by New York State Division of Criminal Justice Services, we were deemed the safest village in New York State based on crime statistics. But it makes logical sense that if you're going to help people get into treatment, then they're not caught in their substance use disorder, so they're not stealing, they don't, and so all that stops, and it just settles down. Also, our domestics, calls for service dropped. Everything dropped in the need for police services. Now, I'm not saying it completely dropped, and there aren't problems, but it dropped significantly where we noticed that. So that's just something that the PARI program, what caught my eye, and that's why I instituted it here, to help people, but also, to prevent crime. And so right now, when someone's ready for recovery, there's this window of opportunity that's time limited. You can't wait till tomorrow. You can't wait a week. When they're ready, you got to get them from point A to point B, and boom. So that's what it became. We became, okay, we're going to save your life and get you from point A to point B. And so you come in, we'll get that. We have great relationships with treatment centers. They're so supportive of the police doing this. Every supervising nurse I've met has shaken my hand and said, Chief, you're doing the right thing. Stop arresting.
You don't call the admissions people. Why? How come you don't talk to the admissions people? You go straight to the supervising nurse on the floor.
Well, what we found with a lot of treatment centers is, number one, there's no competition. So there's no need for quality, assurance, and
Right.
there's customer service, because there's so much out there, so much need. And so admissions many times just says there's no bed, because they just don't want to deal with that person at that time. So we found ways to bypass admissions. We called the supervising nurse on that floor to see if there's any beds. The supervising nurses on all the different places also know we can tell when someone's in withdrawal, so they trust us. So we may say they're not ready till tomorrow morning, or they're ready now. They know that that person will qualify with insurance because of our experiences and our relationship. So really, it's about relationships. It's just about creating a relationship with treatment centers who really want to help people, and work within the dysfunctional insurance system with that. So by bypassing the admissions person and going straight to there, we can get that insurance pre-screen right there on the floor, and then we just go away, because no one regulates the police on this. Other treatment centers and other ERs and stuff, they're regulated on how they get a bed. We have zero regulations, we just get a bed. That's part of our success, is that we don't have to follow any standardization of rules or policies in trying to find a bed.
Right.
We just get the bed.
So what kind of challenges have you had in starting this program? As far as like logistics, like I think you mentioned before, transportation is a huge
Right.
issue. People waiting in the lobby.
Right. There were a couple challenges if anybody's looking to start this program, and many police departments and communities. You have to remember, when I started 2 years ago, there were not many recovery organizations. What I see right now is that there's so many recovery organizations that they're not coordinating together. So there's great organizations out there that don't even know each other, that are in the same communities. So when we started, we didn't have that. We had nothing. So we found that once people came in, first they had to trust us. The word got out in the heroin world that when you're ready, go to Chatham Police. Because after the first couple people came through, they realized we're not going to harass you. We're not going to look down on you. We're going to shake your hand. We're going to say, congratulations for your decision, and we're going to help you. Once that happened, then we found out that 80% of the people didn't have transportation. Either their family didn't come with them, they came in alone, or many times family members didn't want to transport because they were afraid they were going to say stop and they're going to get out of the car halfway there. So they asked us, can you transport, because I'm afraid once we get to the doors, they're going to run away. Right? And that's a real concern for families.
I've done it.
Yeah, so,
I've done it.
but we found when we go with the police, they're not going to jump out of the car. You know, the decision was made. Now, we have conversations too. It's like, I don't know if I'm going to do this. So let's talk about that. What's the hesitancy? And so sometimes we have those conversations on the way down. Most of the time, they don't even think of jumping out. They're in a police car now. It's almost like, I can't, I'm not going to. And that mindset is, all right, I'm going to treatment. I'm in the police car. It's going to happen. You know, I have no out now. I crossed the line. And so, so a lot of families, that's why it's 80%. So what we say is, if you're looking to start up a program, the number one thing is transportation. You're gonna have to put something together. And so there's other municipalities that are looking, and they're coming together with other community organizations to fulfill that. So it's not the police that are always transporting. But we have transported as far as Utica for a bed. We have transported as far as Port Jervis in Orange County. Actually in Dutchess County, we go to Cornerstone. That's one of our great relationships we have with treatment centers, is with Cornerstone. So we've been, people might have seen the Chatham police car come through, and it's kind of neat now, because now when we pull up to all these treatment centers, you know, like all the staff's like, oh, Chatham's here.
Right.
They're bringing, you know, it's not like, why are the cops here? You know, like, everyone's like, cops, cops. Now it's like, ah, Chatham's here. They're dropping off somebody. It's not seen as there's a problem. So it's kind of neat that our relationship within our community and outside our community is very different. They see that Chatham police car very differently. Like, there's always a problem when that car's around. It's not that, you know, they're coming through Dutchess County and they're probably helping somebody, and that's pretty cool.
I think that's an interesting point. I think they're, you know, creating those relationships with people in the addiction community, not just people that work in it, but the people that level of trust that you're building with. That people know that they can turn to you, you know, and like you said, I mean, I'm thinking about how I would have reacted at a treatment center and see a cop car pull up. I'm sure I wouldn't have been happy, and that's great that you're able to turn that around with people. I mean, I think that it's really about building trust in communities, and it looks like you're really doing that. Now, tell us how much that petty crime has dropped in your community.
Yeah, we found that crime has dropped. We found that people are approaching Chatham officers. They're seen as, and I was trained, they're guardians. We're not warriors, we're guardians of our community. We demilitarized our uniform. They wear baseball hats. They wear golf shirts like this. And it's made a difference for the community that we seem approachable now.
Right.
So we've made a lot of conscious choices, not just with Chatham Cares for You, but also to integrate with the community, because, you know, it's our responsibility as police to integrate with our community. It's not the community's responsibility to integrate with the police. We have to. And so seeing that our #1 public health crisis right now is the opioid epidemic, as police, we gotta put that as a priority. How can you not put that as a priority? So within that 2 years, a lot has changed though. Narcan's available and going around, but I always warn everyone that we've given so much Narcan out. You're going to soon hear statistically the amount of overdoses have dropped, which isn't true, because what's happening is friends and family members are Narcanning their loved one, bringing them back to life, but they're not calling 911, so no one knows that there was a Narcan safe. And so the statistics are going to drop, that there's not as many overdoses when it's only because we use Narcan. And I liken Narcan to a defibrillator, because they're like, why should we Narcan them? You know, well, when we Narcan them, then they should be all better. No, because when we defibrillate somebody, there's not an expectation of, okay, now go get help on your own.
Right.
You know, there's an expectation, you've been defibrillated, That's the design of the defibrillator. It's not to
Right.
make you better. And since you've been defibrillated, you need to go and get some more help.
Exactly.
There's something going on in your heart. There's something going on in your body. Well, Narcan's the same.
It
We
is.
Narcan somebody. Okay, something's going on with you. You need more help. We got to get you to the next level of care. And the other thing you hear people say is that, well, they don't want the help. We should force them. You can't force them. It's just like if someone's having a heart attack and they go to the emergency room, you're having a heart attack and the person says this, I don't want treatment, I'm walking out of the emergency room. They can do that. Someone's told you have cancer, I don't want cancer treatments. That can happen. So there's no difference than someone who's struggling with a substance use disorder, that they have the right as an American to say, I don't want treatment right now. And just like the cancer patient may say, I don't want treatment right now, a week later come back and say, I want treatment right now, there's no questions asked about that.
Right.
When that person who's having a heart attack walks out of the ER, then comes back a week later saying, you know what, I need to take care of my heart problems, there's no question with that. Why are we questioning somebody who walks out of treatment, then comes back time later and says, okay, I'm ready now? It's the same medical illness type of thing.
Right. I personally, I've been through treatment. I think, I mean, honestly, I haven't sat and counted, but I'm sure it's at least 10 times. I've completed 5 times. And sometimes it just takes doing it over and over and over again until you get it right.
Oh, absolutely. And,
So-
and you also hear the other thing, especially with treatment, and don't think that when I decided I was going to be sober, it worked the first time. I had some relapses, and each relapse I had to learn what stress caused that. So I need to deal with that stress, but I had to learn the funny feeling. When I get that stressful, funny feeling, I can't ignore that. I can't say it's going to go away. It'll just, I have to call somebody and talk about my funny feeling in my body. And that's because that's my precursor to drinking.
Sure.
I'm stressed out, I got that funny feeling, here it comes. So once I've learned that, my bad days are now bad moments.
Right.
And so I've really worked through to moments now, okay, and I reach out. So, so we see people coming in, but we have to learn that. And so I'm coming out to talk about my recovery and my road, and to talk about the struggles that we all have. We all struggle in life. Unfortunately, in our society, we're looking for that feel-good thing. We're looking for that escape, and we'll always do. As human beings, we've always tried to do that. We always try to feel good and escape, and life doesn't always feel good. And life can be painful at times, and there's no pill for that.
Oh, trust me, I know that. I'm sorry.
But there's just no pill that we can get for that. So it takes people a couple times, and I don't call it, people don't need to hit rock bottom and lose it all. I didn't. I had what's called a turnaround moment.
Right.
That there came a point where it just was like, okay, I can't do this by myself.
Right.
I got to change my life. I can't live this way. And it was that person who reached out their hand that said, I'm ready. And that's all Chatham Police is doing. We're just reaching out our hand. We're not going out and grabbing it. But it's, reaching out that hand, when you're ready, we're right here. Just, we'll grab our hand, and we're going to get you that step.
And you're telling that person that they have value, and I think that's so important, because when you're down and out there, you really feel worthless. You really feel like maybe you're not worthy of getting any help. So I think that's I'm just guessing that that's a huge piece of it.
And that's that power of addiction. I call them thugs in ourselves. And we all have those thugs, and those thugs can be real, and they can be nasty, and you don't have to hate the addict. They hate themselves enough. And so my thugs, when something happens, they can really get me down, and I'm not worried that nothing's going to happen, and I'm all bad. But once I learned about those thugs, then I learned how to deal with them. But if we're trying to ignore those thugs that we have, and it's not going to go away. The thugs never go away in our life. So you're right. So I think that is true, and it's a struggle internally because the shame and the stigma that comes with it. If you had a heart attack, there'd be so much support. And people have heart attacks because of their lifestyle.
Right, true.
You know, and people get cancer because of their lifestyle, and people get, you know, just have diabetes because of their lifestyle. They have all these different things because of their lifestyle. This is just, people are struggling with substance use disorder because of their lifestyle.
Right.
You know, and so if we start just putting them on an equal playing field, that'll take that stigma away, and that'll take that shame away of reaching out. So we're just trying to say, reach out. You know, and I learned that there are so many people that have supported me over the years that I never even knew, that invested in my life. That is just amazing. But it was that firsthand that made the difference for me.
I have a question.
Sure.
How have you dealt with the challenges of somebody coming in and asking for help who doesn't have insurance?
Oh,
Because he loves
great
that.
question. Yeah, I love that.
Oh,
That's
okay.
actually the best thing that can happen. I'll start backwards. The worst insurance is private insurance to get approved. Then comes those Medicaid and the Affordable Care Act, people in the Affordable Care Act. But if you have zero insurance, I'm trying to get the word out with that, still come in. Because when someone has no insurance and they come in, they automatically qualify for Medicaid. When you automatically qualify for Medicaid, in the first 30 days, everything's approved. After 30 days, then they put you on a plan, and usually it's CDPHP or Fidelis. So for that first 30 days, I know I'm gonna get approval for everything. So don't worry. When you, that's what I'm tell anybody, I can't go, and that's a barrier that people, it's a fallacy that people think, I don't have insurance, you know, I'm 26 years old, I'm 28 years old, I never had needed insurance, and there's no way I can get help now.
Can you talk about the difference between New York State and Massachusetts, and then the CAL, you said they should just dispense with the CAL and something
Right.
else?
There's two things that people ask me, what should we get rid of right away? The first one is something called the locator, and the second one is the COWS score, C-O-W-S score. And each of them is, you have to, they ask you a pre-screen, and if the way you answer, you get more points. And once you hit a criteria, then you qualify for rehab or detox. What's an example? If somebody is homeless, they get more points because they're more at risk to, you know, for substance use disorder. If someone has the sweats and is sniffling, you get points for that because you're in withdrawal. If someone reports that they have diarrhea and are vomiting, you get points for that. So once you hit that threshold, they say you're in withdrawal. That is all subjective, because here's what happens. You ask somebody, so, you know, are you nauseous? A little. You know, that doesn't qualify you, right? Or are you homeless? No, I live from friends to friends and family's house. So then they say, oh, they're not homeless. No, they're homeless. They don't have a home. They're living from house to house. So we have to, just that locator doesn't work. And the COW score is how much sweating are you? You know, it's just subjective. And I'll tell you this, we as cops can tell when someone's in withdrawal. Anybody can tell when someone's in withdrawal. You can't fake that. And why would you fake withdrawal to go into detox? You know why? Because that first 24 hours, that's 1 day less that insurance has to pay somebody. That's all it is. Think how the millions and millions of dollars it is saving insurance companies by having one less day of detox. And so they'll wait till you're really suffering instead of bringing someone in. Yes?
Me?
Yeah.
Okay. Couple about last week on CNN, Sandra Gucci, who's their medical, whatever you call it.
Oh, yeah, the doctor.
Oh, okay. He had a program which said that smoking pot would be a better choice than opiates. He had a long program on it. And he said for pain, he said for, I don't know what else. Now, I don't think what you can get at medical marijuana is real strong stuff. I don't think it's the street stuff. I think you get, you know, something else. But I wondered what you thought about that, if you thought there was any,
Well, I'm not a medical doctor,
Yeah,
but
okay.
what I find is, and I liken this to, they're finding out a lot about opioids and how to deal with that.
Right.
And really what we're talking about is harm reduction.
Okay.
So would it be better to smoke pot than
Yeah,
to
yeah.
use heroin? And I say we already are doing that with alcohol. We used to have prohibition way
Yeah.
back when in the 20s where alcohol was outlawed. During that time, it was violent. Many cops died trying to arrest people. Alcohol went underground.
Yep.
It was an ugly, ugly time for our society, to the point where they said, okay, we're going to bring alcohol to be lawful again, but we're going to regulate. And today, alcohol is regulated where we have safe sites to drink alcohol,
Yeah.
called a bar. You have to be 21. You can't drink and drive, but we still allow alcohol in. So when people say, I don't want safe sites, and why do we have safe sites of a bar, and why do we don't allow open containers, right? It's to minimize the impact of alcohol and what it can do to our society. Well, that's the same argument that people are saying for heroin. Why don't we have safe sites? Because that'll take it off the streets, no open containers of heroin or people shooting up. But if you come to a bar, that's the way I can describe it. You come to a bar, not only that, there'll be a nurse, there may be a physician's assistant, there'll be people there, and there'll be a counselor saying, are you ready for treatment? Are you ready for treatment?
FYI, just so you know, I launched a petition for a safe injection site in Dutchess County, and it's a change.org, and a bunch of people signed on. And just yesterday and the day before, there was an article, I think, in the New York Times that the de Blasio administration looks like they're trying to go ahead with it, but federal law may preempt, or I don't know.
Right, so we don't know, but
We gotta keep on pushing.
if we look at Canada, their first injection site had over 2 million people come in and use heroin, and not one person died at the injection site. So that fallacy that people would be dying there, and I'll say this also, I understand we're worried about the effects of heroin, but the effect of alcohol in our society today is devastating.
My husband died of lung cancer from cigarettes.
Cigarettes too.
Okay, he tried to
My
quit.
grandmother.
Yeah.
Your grandmother the same. He tried to quit. At least he said he did. Couldn't do it.
And my father was an alcoholic who killed himself, yes, full
And well, Frank
disclosure.
didn't kill himself, but I mean, he died,
Yeah,
you know, eventually. So I
So-
can think that that's a menace that,
but if you look at cigarettes, you look at alcohol, it's killing more people than the
Yeah.
heroin right now. But what we've done is we've accepted those drugs,
yeah.
and we're accepting the amount of people that die. So, you know, so now they're saying, well, let's kill drug dealers. That's the big thing now. And I said, well,
Duterte
all right, so
and the Don.
if you can't arrest your way out of it, you can't execute your way out of it.
Certainly can't.
And so if we're gonna execute drug dealers, how about this? Why don't we execute people who kill people in a car accident? The driver who was drunk that killed somebody else in a car accident. Why don't we execute them? And why don't we execute bartenders that allow people to get drunk and then leave their bar
The
drunk?
doctors who overprescribe.
Or how about the doctors that overprescribe, right? So, you know, let's just pick on something, once again, let's get angry at the drug dealers, they're no good, and let's look, you know, in contempt towards that. So let's do the level playing field if we're gonna do the execution, if we're gonna do all that stuff, and we don't, because we've accepted alcohol and we've accepted nicotine and cigarettes as substances that are regulated, and the proper regulations we accepted. So all we're looking at is, let's take opioids, since we've created our problem with the overprescription, and we've created our problem with pain scale, and we've created our problem by just say no, and all that sort of, let's just try one harm reduction place.
And I think it's important to point out too, at least in my experience, of course you have big drug dealers, but most people that are dealing drugs are doing it because they're supporting their own addiction. It's just, so you get them help and you're, you
Right.
know.
And you've actually, you called into my radio show a week or two ago, you said, to your credit, that you've taken 3 or 4 drug dealers off the streets,
Yep.
not by putting them behind bars, but you've gotten them treatment.
Yeah, and they actually told me, I deal drugs because I can't afford my habit, and I don't want to steal from others.
Well, I think that's another thing, the money part.
It's about money, they can't afford
It
it.
is a, you know,
You said it's about $100 a day for 10 baggies?
Yeah, it's up where we are, it's about $100 a bundle, which is 10 baggies that way. It's different all around the state, and so, but the little drug dealers that are dealing are doing it for their habit, and like I said, I was amazed when he said, I don't want to steal from people.
Yeah, well, that's.
So the only way I can keep my habit is to be a drug dealer, a local drug dealer. Because I refuse to go and steal from stores, I refuse to go and steal from people's homes or steal out of their cars. I think it's wrong. I'm caught in my addiction.
Well, I think I'm a grandmother of a 14-year-old, and I'm always worried that he'll get involved. I mean, I wouldn't put it past Mac. You'll hear this, so I'll have to take some pictures.
Little Max?
Little Max. I
Veronica?
wouldn't put it past him. You know, he's got his pals around, and you don't know what the hell they're doing, you know what I mean? You don't know if they're out somewhere. So, God forbid, I don't know, some things we can get on, but we hope not.
We've always had things that could hurt us.
Sure.
It's part of being a human being, you know?
Yeah,
We get in
sure.
cars, I worry about my kids in cars driving.
Of course,
It
exactly.
could hurt us, and so temptation is part of the human experience. And you never know, you're right.
Well, I mean, if you tell a kid, don't touch that hot stove, that's the first thing he'll do.
Yeah.
Never
So
question it.
maybe
That's-
part of the answer is, decriminalizing or taking a model like Portugal, honey, went to.
Okay, so I've known about this for a while. You know, Michael Moore came out with this movie several years ago, Where to Invade Next, but it's really not about the military. He goes around different countries around the planet talking about wonderful things, but I knew about it long before that film. He goes to Portugal and he interviews the, I guess, Minister of Health. And have you seen the movie?
Yes.
Chief Volkman has seen the movie. So I confess, God help us all, yes, the Dutchess County legislator for Rhinebeck and Clinton, I would not be opposed to decriminalizing everything. Because that's what they did in Portugal, and the drug overdoses went way down, and the deaths went way down, and the addiction went way down, because they treated, you know, drug addiction as a public health problem. And it was the same thing, you know, Chief Volkman and my wife and I, we were a couple hours ago in Poughkeepsie at the Family Partnership Center with about 24 people talking about all this. And it was ironic because 2 years before this, in the summer of 2016, there were 200 or 300 people who filled up that room. It was a big forum the Poughkeepsie Journal organized on what are we going to do about the opiate crisis, the opiate heroin epidemic, and over and over and over again there was a mantra that was stated repeatedly that night. And the mantra was, drug addiction is a disease, not a crime. You know, it's a disease, it's a public health thing. But it's not being taken seriously. And again, at the risk of sounding like a broken record, 2012, the Dutchess County Criminal Justice Council came out with this report. We need a 24-hour mental health drop-in crisis center. It's like a dog with a bone, a broken record. I beat that thing into the ground for years, 2012, 2013, 2014. How come Dutchess County doesn't have a 24-hour mental health drop-in crisis center? And I asked the Dutchess County Department of Mental Hygiene Commissioner at the time, Margaret Hurst, in November 2014 during a budget review meeting, and was there anything in the county budget for that in 2015? She just looked down and said no. And then USA Today did a big thing in November 22nd of 2014 about Miami-Dade County going from 7,800 inmates to 4,800 inmates, saving $12 million a year, shutting down one of their jails, by making sure that nonviolent mentally ill folks and nonviolent drug addicts aren't arrested or jailed. So I saw that. I don't usually read USA Today religiously, but I happened to see that article. So I circulated a letter January 6, 2015, and just about everybody in the Democratic caucus in the Dutchess County legislature signed on, and lo and behold, Marcus, the county executive Molinaro, got religion and he started singing my song. Of course, I didn't get any credit, not that I'm bitter, I would never be bitter. But he's at the Bardavon, forget my, and I know he lives in Rhinebeck, Red Hook. Hi Marcus, he's watching this. He's too busy to watch this. So in late January 2015, Molinaro was on the stage at the Bardavon at Steve Salan's Dog and Pony Show, the Dutchess County Criminal Justice Council External Advisory Group meeting. And Molinaro, to his credit, to be fair, the county executive standing on the stage, and this is what we're going to do. We're going to make sure all the law enforcement officials, officers in Dutchess County are trained in CIT, crisis intervention training. We're not going to arrest or jail, you know, nonviolent, mentally ill, nonviolent drug addicts. Yay! And a month later, he announces during the State of the County address at the CIA that we're going to have the Crisis Stabilization Center, the 24-hour mental health drop-in thing that I've been talking about for years and years. And even the Poughkeepsie Journal reporter came over to me. He's like, that's your thing, right? And I'm like, yeah, thank you for recognizing that. And there's national media attention on Marcus making that happen. But here's the thing. That Crisis Stabilization Center has diverted a lot of people from jail, and that has. But, and it's a big but, as they say, I know because I get the census reports. Back when the Dutchess County Jail Administration used to share with me this information, and if you read my little column that appeared in my good friend Jim Langan and Caroline McCarthy's publication, the Hudson Valley News, it was in the Poughkeepsie Journal. At the very end of the article, my column, I referred to how the Dutchess County Jail Administration, they don't want to share the information anymore. But I'm telling you, for 4 or 5 years, every time I got a census report, a 170-page report, I would go through it with a fine-tooth comb, and I would see 25, 35, sometimes I would see 60 people in there out of everybody, human beings locked in cages, nonviolent drug addicts. All they did wrong was criminal possession of a controlled substance. That's all they were charged with. I started grilling, gently, publicly, Dutchess County District Attorney Bill Grady on this during meetings of the county legislature for years. And he fiercely defended it. Republicans in control of the county legislature here in Dutchess County, fiercely defending this. So we have this sort of cognitive dissonance, incongruence of the county executive saying one thing, and so that's why, and I'm glad that 9 or 10 of us in the county legislature in the last 2 years have signed on to letters saying let's make PARI happen, the Police Assisted Addiction and Recovery Initiative, PAARIUSA.org, the Gloucester, Massachusetts model, the Chatham, New York model. But now I really want to see people show up at Rhinebeck Village Board meetings. There's what, 4 Democrats on the Rhinebeck Village Board? And I know Howie Trout, and I love him dearly. And here in Rhinebeck, there's what, 5 Democrats on the Rhinebeck Town Board? And a whole bunch of Democrats and good Republicans in Rhinebeck and Red Hook. Why can't we make Rhinebeck the first PARI community in Rhinebeck? Why is it that, can you talk a little bit about Red Hook? How there are residents, thank you, sweetie, there are residents of Red Hook who are so frustrated, they have forced to drive an hour, hour and a half north to freaking Chatham to your program to get help and assistance.
And the amazing part is, they'll drive all the way up, and sometimes we get a treatment bed in Cornerstone. So then we have to drive all the way back to Dutchess County so they can get treatment, when all it took is if it was a local police department, they could probably...
And any other towns in Dutchess County besides Red Hook that you've had folks from?
There's different ones, Poughkeepsie, we've had, I'm trying to remember exactly which ones. But
I'll want that information.
yeah, we'll look that
All
up
right.
for the different towns. That's part of the, Albany has counties, I don't know.
Because that can help us make the case.
Right. But we do have Dutchess County residents. We've had police officers from Dutchess County call and say, how does a family call you? And I say, call my
That's
personal cell. So there are officers, I'll tell you, that see the value of this.
That's officers here in Dutchess County.
Yes.
They want their names, rank, and serial numbers, and promotions for those people.
Yeah, promotions. But they're, they see value, and this is not the answer, and I just want to make that clear, but this is a solution that many communities, if 10 people a month walk into Chatham, and we help an average, that's it, 10 people a month, every third day.
You saved 180 people in less than 2 years, right?
Less than 2 years.
Every single person you've gotten treated for.
Gotten treatment. One took 12 days, 11 days, because that was an insurance problem with Medicare. And Medicare, it takes 10 days for that to clear out.
What's the difference between New York State and Massachusetts you found on this?
Oh, with Massachusetts, if there's any type of insurance problem, the state of Massachusetts says, or the Commonwealth, that we'll pay for it. Just get into treatment, we'll figure out the insurance problem, that we will cover that. So there's not an insurance dilemma.
And in New York
that we have.
State?
New York State is you have to have insurance. And if you're on Medicare in New York State, you cannot go out of state. But we don't go out of state. We only stay in New York State that anyone who is OASIS certified. So there's some regulation on the quality of care through New York State OASIS. When you go out of state, there's some great treatment programs, but there's some programs that aren't, and we don't know the difference
Right.
with that. So we stay in New York State even with private insurance because of that. At least they're regulated by OASIS of minimum standards that they have to provide as a treatment center.
Sure.
So,
What does OASIS stand for?
Office of Alcohol and Substance Abuse Services. Yeah, Office of Alcohol and Substance Abuse Services. So they're the New York State regulatory system for treatment centers. They're the ones that get a lot of grants to different counties for treatment and recovery centers. So, and they set standards, the standards of care for New York State.
I think that sometimes, oftentimes, here in Red Hook and Rhinebeck, maybe Hyde Park, we're a little isolated. You know what I mean? We don't have these. Now, if you go to Poughkeepsie, Kingston, they're going to be hit with a lot of these problems that we say we're not affected by. Now, maybe we are, and we don't know it.
Well, I'm gonna interrupt on that because
Okay.
there's somebody that I used to work with decades ago, and that, you know, one of their children, you know, teenager, right here in the village.
Okay.
In fact, actually, there's 2 young people that I know.
All right.
And this is, it's not a panacea, it's not a cure-all, but can you talk about what you're accomplishing up there with, what's your budget, how many people live in Chatham, and how many part-time staff?
Yeah, we're a village of about 4,000 for a very small village. And we have about 24 part-time police officers. And our budget to run the whole police department is $157,000 a year. That's it, to run everything.
So
with
you've trained
salaries.
22 police officers, part-time police officers, how to navigate the whole system.
And yes, and if they have trouble, they call myself or the lieutenant. And, you know, so we get the weird ones or the problems with insurance, and we know who to call and to deal with that. The other neat part about that is that we've received over $7,000 in donations from our faith-based community and also from individuals to keep our police department running. Who ever heard of a community donating for their police department to keep them running? I mean, it's a miracle. That, you know, it's a miracle in Chatham. Everything we're doing is absolutely a miracle.
And the angels, because sometimes there's a gap, the community angels, you don't need them so much anymore. But
Right.
Can you talk about that?
Yeah, what happened
And
was-
the Chatham Cares for You Facebook page, spell it out, please.
Okay, sure. With the Chatham Cares for You, it's Chatham Cares, the number 4 and the letter U. So go to Facebook, like it. Every time you'll see a CC for You, we call it CC for You, CC for You update of everything. Or if we have a bad batch, we put out notifications to everybody that way. So what we found with our community angels is that we now have a hope line that you can call. And so you'll call one of our volunteers, and really our angels went to the hope line, talk to somebody who understands, and they fill out a form, and that goes to the lieutenant and myself. So many times when someone's ready to come in the morning, they call at night, they're ready. We'll say, okay, come in at 8, 9 o'clock in the morning. We already have a bed ready because we've already made the connections that afternoon, that night. So when they walk in, all they have to do is a pre-screen. We have to see that they're in withdrawal, and then they're on their way. We've had people leave as quickly as 10 minutes. They were in, we pre-screened them, and they were on their way in 10 minutes. And it's, families are just amazed at that.
I just thought that here in this community, we may not recognize this stuff as
Correct.
quickly as you would in Poughkeepsie. Or
Sure.
I mean, you know, and this thing can be going on with your son or daughter, grandson, or whatever it is.
Absolutely.
And you may not know a damn thing about it.
Most of the time when family members notice, they are deep into it.
Deep into it, right, that's what I was
Because you
gonna
can
say.
function while taking pain pills in life. You can take a pain pill and be able to function very well.
Sure.
You can take heroin and be able to function. But by the time families notice, you're right, they're deep into the...
They don't, see, in my day, we never had any of this drug stuff. Alcohol, yes, you've had that since the beginning of time. Kids were always getting drunk and all that stuff.
What about reefer madness?
Well, in the 60s, if you lived in the city as I did, you couldn't go out to a party, you couldn't go out to anything. You just get off it automatically, a smoke. I mean, this was just automatic. So, not the heavy stuff, but
Right, just the-
pot. I mean, that was...
Do you miss those days?
But I mean, that was all, it was just nothing. Nobody thought anything.
Very different
And
now.
nobody thought a thing about it.
Times have changed
Yeah,
now.
I'll tell you.
So that was the answer of how we're getting by. And if we run out of money, if, you know, the village board is very supportive. And if that ever changes, we've had a good run and we'll be grateful for what we've done with folks.
I have a concern that if someone comes in and you're, like you said, you had 10 days before someone could get insurance, what do they do during that 10 days to feel
good question.
safe regarding, they're withdrawing, they need their substance in order to just function, and how do they, not be arrested but stay within
Sure.
the
We
system of
put in
being-
a safe plan, and
Yeah.
many times we'll have mobile crisis. So a couple times, we had to put them in a homeless motel. We call our Department of Social Services, which is very supportive. The caseworkers will get a motel for a day or 2 days, or that was 10 days.
Right.
But we kept in touch with them, and that person stayed sober and clean for 10 days because they really wanted to get into treatment, and they were very highly motivated.
But even if people are withdrawing from heroin, that's not the same kind of thing in that, with the diarrhea and the
Right.
constant vomiting, that, over a 10-day period, that's a long time to go without it.
Usually it takes a couple days of I call it getting over the hump.
Yeah,
And so once you get over the hump, now you're just like you have the flu and you can function. And that takes another week or two. But actually it takes 6 months to a year for your body to kind of get back to biologically normal that way. But when we have trouble, we have caring attachments, and we just stay close to them and close to them. And sometimes people have relapsed. Or
so they're protected though, by, you
Yeah,
protect them so they don't have to go to jail,
Yep.
or they're,
I've actually
Yeah.
gone to the homeless hotel in my own personal car, my own time.
right.
We went and got something to eat, and he went back to the hotel. And we were like, and he was very grateful for that. He didn't have any money or anything. And
That was wonderful.
our officers do that, But because they know every day we're gonna call and every day we're gonna come by,
They have that
keeps it
support
going.
that they
Yeah,
know they
hang
can
in
count
there.
on.
Hang in
Yeah.
there, I'm really trying. And I know, Chief, you're really trying to get me bad. Just, I'll do it if you'll do it. And so it's that caring
support
attachment.
that makes the difference, that gets them over the hump.
That 10 days was kind of an anomaly, I think, that he's
Yeah,
able
it
to
was one time. It was-
get them treatment, usually, generally, very, very quickly.
It's 2 or 3, 3 at max. Usually it's easier to get detox because they're medical emergencies, especially with alcohol and benzodiazepines, as compared to a treatment, inpatient treatment. But now we have ambulatory detox option. We have day programs. So there's so many. That's why we have to sit with somebody, because some people have a job and they're saying, I can't go away. I still have to work. I have a family to
Right,
take
that's
care
why
of.
it's so bad if they get put in jail, because their
lose
families
their
are
job.
disassembled
Right.
and they lose their jobs, and
So we get them
and if they get a
treatment.
felony, then they,
On top of that,
totally
absolutely.
changes anything if they're young and they want to go and become an electrician or something, they
Right.
can't do that.
But with
So,
ambulatory
yeah.
detox, they can go after hours and talk to a doctor, talk to the counselor, make sure their meds are good, and keep them going through that, and they keep their jobs. And nobody knows, and they wean off.
What is ambulatory
Detox,
detox? I'm
that's-
not familiar
Yeah.
with that.
Ambulatory detox is the newest thing that's coming out, and what happens is, it's not inpatient, you go for about an hour a day, and they're open from 9 to 9, most of them. So after hours in case you work. And then you speak to the doc, just to make sure your medicated assisted treatment, you are good for that day. You speak to a counselor, a social worker, and you have a session. And some people, it's not because they work, they say, for some people, inpatient detox doesn't work.
Terrifies.
Yeah, I'd rather go home and suffer.
Right.
I
True.
have supportive family, they're gonna keep an eye on me. I don't wanna go inpatient to a detox hospital, I wanna go home. So that way you get your medication for the day, your Suboxone, and they make sure it's the right amount. That's why you have to go every day, just to make sure your
Right.
levels are good. And with Suboxone, at least you can go to work, you feel terrible, it's like you're on the flu with steroids. But you're able to get through. So what's happened is we've had a lot of people come in saying, wow, now that I heard about ambulatory detox, I'm looking for that. So we've made great relationships with treatment centers on that. So it seems to be a great option for some people, and they're coming forward.
Sure. Now, after they complete the detox, I assume they get into some kind of outpatient treatment?
Yes.
Because I think that having that sense of community is so important. Feeling that you've got the support system
Absolutely.
Yeah.
And ambulatory detox is about 2 weeks. It's not 2 or 3 days.
Oh, okay.
Right, so in that 2 weeks now, that's where you're creating, whether it's an outpatient or whether they get you to a counselor, what, you know, they find out what's best for you in your next step of recovery.
Sure.
So it's just a different path. But yeah, it seems to be effective for some.
It's wonderful.
From what I'm hearing, I'm sorry I came a little bit late, I'm not seeing a police department, I'm seeing a drug treatment center and the intake proceeding run by police officers. So what about those who mainly come into the system following an arrest? What is the process there? What do you do, especially with the district attorney controlling the process, or the absence of any district attorney reviewing the arrest records and bail issues and someone being confined and being delayed the opportunity for arraignment even?
Okay, so the first thing is what we have is we are not a diversion. You're coming in voluntarily, not in trouble with the law.
Correct.
Right? And so it has nothing to do with district attorney. Someone's coming in asking.
So
for
you're
help.
doing like I say, you're a drug treatment agency
We're
wearing
not
a
treating
uniform.
anybody. We're not treating. We're like an ambulance service.
Right, you're
Okay?
making the referrals, you're the intake of what happens without the normal police arrest feature.
Correct.
And so, but what happens when the arrest is the starting point?
Oh, okay, so this happened to us. Someone was arrested for drunk driving. They turned to the officer and went, "I want Chatham Cares for you right now so you don't arrest me." And the officer said, "After the booking process and after you go before a judge, you can come back to us and we'll help you find a bed." The other thing that happens is when they come into us, we do a warrant check, and about 10% of the people have active warrants. And so we'll call the local judges, and they work very well with us. They're like, "You got them a treatment bed? Bring them in, we'll ROR to a new date after treatment." And so what we have found is the court has actually been very empathetic, seeing that this gives this a person a chance. So we have had to arrest people, and they try to instill the Chatham Cares for You program, but that's a process that just goes, once you're ROR'd or given bail by the judge, now you voluntarily come in again. And that person actually did. They were done with the court, and they came across the hall to us and said, "Okay, now I'm ready." And we're like, "Wow, we thought you were just trying to get out of it. We didn't know you were, you know." And so we helped that person find a bed. So that's the two ways. But it's more of when we do a warrant check that we find, you know, you're going to have to go before the judge. And like I said, I don't think I've had a problem with a local judge, even a county judge, court judge.
But this is atypical of police departments and prosecutors throughout the state.
This is 24 police departments in New York State do it, and about 210 in the country do this program.
And how does your program interface with the OCA drug court
We have
programs?
nothing to do with drug court. We're totally separate from drug court. Remember now, our program you're not in the criminal justice system. So you're just coming in just like somebody comes in with a problem. And we assess, take action for the referral. What we're finding is this: somebody comes in with this problem, we started calling around, "Sorry, can't help you. Go to the ER." You go to the ER, the ER says, "Well, it's not a medical emergency, we can't help you."
Right.
Here, call these treatment centers. You start calling these treatment centers, guess what they're saying? No beds, no beds. So you go on the Oasis website for an open bed. You call that number, no beds. So that's why there came a point when it's like, somebody's got to do something. This is ridiculous. This system, I could see how families give up. I could see the anger with this. So we had to learn that dysfunctional treatment system and how to navigate it. Where families only get one, this is their first time. I've had 180 times to navigate this. I know it. With confidence, I know this system. Probably more than most people. Even in the medical field, even in the health and human services, because we've navigated it to success of 100% success rate. So why is the cops doing it? It's a cop thing. I don't know. Maybe the treatment centers hear their cops. They also say that when the Chatham people, they call it, come in, counselors love the Chatham people because they're ready. If you think about it, a person's walking into a police station saying, "I'm a heroin addict, help me." They're ready. They're ready more than anybody else at that point. So I think that has to do with it too. We're not going out looking for them. They're coming in. So, as I taught my officers, who are we to say, no, we're not gonna help you because you're a heroin, we don't like your problem, but we'll help you with your problem. Once we start choosing, that's a bad thing in policing. And judging, that's a real bad, slippery slope you're going down and making that. So there's a definite separation from the court system. The other thing that's kind of neat statistically, 60% of the people that have come through us have never been arrested for drugs.